All right, let's jump right into a question we see a lot, especially for anyone who's been through heart surgery. It's a big one. If you have a mechanical heart valve and you're on anticoagulants, can you actually get a tattoo or a piercing safely? It's this classic tug of war between wanting to express yourself and making sure you're protecting your health. So today, we're going to break down everything you need to know.
Here's how we're going to tackle this. First, we'll set up the question that's on so many people's minds. Then, we'll get into the main risks you absolutely have to be aware of. After that, we'll cover what the medical world actually says about all this. Then, we'll give you some practical real-world tips if you decide to go for it. And finally, we'll wrap everything up with what it means to take a responsible approach.
So let's kick things off with the question itself. And really, if you're living your life after a major heart procedure, this is a totally valid thing to wonder about. You are definitely not the first person to ask this.
And this really is the million-dollar question, isn't it? On one hand, you want to be you. You want to have the freedom to decorate your body and express who you are. But on the other hand, you've got this new reality to manage. Your heart valve, the medications that keep it working. So how dangerous is it, really? Let's dig in.
Let me take just a few seconds to say that, if you'd like to support my project, you can offer me a symbolic coffee on Ko-Fi. You'll find the link below in the description. You can also check out my book, where I've gathered many experiences and useful tips. Every gesture means a lot to me and truly helps me keep this channel and the whole project going. And if you haven't done it yet, I invite you to subscribe to the channel, turn on the notification bell, and visit my website or blog for more content. Thank you from the bottom of my heart.
Well, as you've probably guessed, there's no easy black and white answer here. It's not a hard no, but it's for sure not a yes without any strings attached. The real key here isn't about forbidding it. It's about understanding the specific risks involved so you can make a decision that's truly informed and right for you.
Okay, so let's get into the nitty-gritty and talk about those risks. Because honestly, understanding these is the single most important thing you can do to keep yourself safe. We're going to break down the 3 big ones you have to keep on your radar.
First up, bleeding. It's kind of obvious when you think about it. Anticoagulants, those blood thinners you're on, their whole job is to slow down clotting. Now imagine a tattoo needle making thousands of tiny punctures in your skin. Well, that means you could bleed more than someone who isn't on that medication, and the bleeding could go on for longer.
Now for risk number 2, and listen up because this is the big one. We're talking about infection. Anytime your skin is broken, it's like opening a door for bacteria to get in. But for someone with an artificial heart valve, this is a whole different ballgame. If bacteria get into your bloodstream, they can travel straight to your heart and cause something called bacterial endocarditis. It's a very serious infection of the heart lining and the valve itself, and it's the #1 complication you need to prevent.
And finally, there's the healing process. Your body might just take a bit longer to patch things up. Now, that's not just an inconvenience. Remember that open door for bacteria we just talked about? Well, a slower healing time just means that door stays open for longer, which bumps up the overall risk of an infection taking hold.
Okay, so we've laid out the risks. Now, what's the official word from the medical community? This is where your doctor becomes your absolute best friend in this whole process.
So here's some good news. There are no hard and fast rules saying you absolutely cannot get a tattoo or piercing. But, and this is a big but, it's not something you decide on a whim. The medical guidelines are really clear. Every single person's situation is unique. So your first non-negotiable step is to sit down and have a serious talk with your cardiologist. They might even suggest a course of antibiotics before the procedure, just as a safety net to prevent that dangerous endocarditis infection we mentioned.
And it turns out not all piercings are created equal when it comes to risk. Doctors will almost always tell you to steer clear of piercings in your mouth, like your tongue or lip, or your nose and other mucous membranes. Why? Well, it's simple. Those areas have tons of blood vessels and are just packed with bacteria. That's a combination that seriously cranks up the risk for both bleeding and infection.
All right, let's say you've weighed the risks, you've had that crucial chat with your doctor, and you've decided you want to move forward. So, what now? Let's dive into some real practical steps you can take to make this as safe as it can possibly be.
Think of this as your personal safety checklist. For both tattoos and piercings, rule number 1 is hygiene. Hygiene, hygiene. You have to go to a certified professional studio that uses sterile, single-use equipment, no exceptions. For tattoos, maybe start with something small, and always be upfront with your artist about your medical situation. And I cannot stress this enough, never, ever stop taking your anticoagulant medication unless your doctor specifically tells you to. For piercings, it's smart to stick to safer spots like your earlobes. And for both, you have to be obsessive about aftercare. Watch for any signs of infection. We're talking swelling, a fever, any weird pain. And if you see anything, you call your doctor right away.
So we've covered the question, the risks, the doctor's take, and the safety tips. Now let's just pull it all together and talk about the right way to think about this whole thing.
So, what's the bottom line here? It's this. Getting a tattoo or piercing isn't off the table, but you have to go into it with your eyes wide open. This isn't about restriction. It's about being responsible. It's all about balancing your desire for self-expression with the reality of your health and making smart, informed choices every step of the way.
You know, I think this quote from our source material just says it all, perfectly. The freedom to express oneself is a right, but health comes first. And that's really it, isn't it? Go ahead and be you, but your health, especially with a mechanical heart valve, has to be your absolute top priority.
And just one last thing, and this is incredibly important. We've gone over a lot of information today to help you understand the landscape, but this is not a substitute for medical advice from a professional. Please, always, always talk to your own doctor or your cardiologist before you make any decisions. They know you, they know your health history, and they are the only ones who can give you advice that's tailored specifically for you.